Good morning, students. Now we can go through ethical guidelines for clinical research. These are the ethical guidelines for clinical research. First, required is the voluntary, well-informed, understanding consent of the human subject in a full legal capacity. It should be voluntary, not coerced or compulsory. Okay, it's a voluntary, informed consent. Informed consent means the researcher should inform about the research very well. After understanding, the participant should give a consent to participate in the research. The experiment should aim at positive results for society that cannot be produced in some other way. So experiment should have some positive results or positive expectations for the society. It should be based on previous knowledge. So expectation derived from animal experiments that justifies the experiment among humans. So it should be based on previous knowledge. The experiment should be set up in a way that it avoids unnecessary physical and mental suffering to the participants and injuries to the participants. It should not be conducted when there is any reason to believe that the research implies a risk of death or disabling injury to the participant. It should not be conducted if there is any reason to believe that the research may imply a risk of death or disabling injury. The risk of the experiment should be in proportion to humanitarian benefit. The risk should not exceed the benefit. So risk should be in proportion to the benefit. Benefit should be more. The risk should not be more. Okay. Preparation and facilities for the research must be provided that adequately protect the subjects against the experiment's risk. There should be preparation and facilities that adequately protect the participants against the risk. The staff who conduct or take part in the experiment must be fully trained and scientifically qualified. Human subjects or participants must be free to immediately quit the experiment at any point of time when they feel physically or mentally unable to go on. Full freedom is given to the human participants to quit the experiment at any point of time. They have the freedom to participate or not to participate. Nobody will compel them to participate in the research. Medical staff must stop the experiment at any point of time when they observe that continuation of research would be dangerous to the participants. Thank you.